Hi, everybody. Thank you for coming here and joining me today. I'm really excited to talk to you guys about my topic for this presentation. It is called Pedal with Purpose, specifically addressing how to prevent cycling injuries while improving your riding efficiency. This can apply to whether you're a road cyclist, whether you're a station bike cyclist, mountain biking, recumbent biking. There are some variations, but we can address those with questions at the end of the presentation. My name is Dr. Nick Yap. I'm a chiropractor here at Total Body Health. I have a background in strength and conditioning as a strength and conditioning coach, and I operate a movement-based practice. What is a movement-based practice? I implement strength and conditioning, exercises, and rehabilitation as a big part of my treatment approach, on top of manual manipulations, adjustments, soft tissue mobilizations, and joint mobilizations. I am a daily commuter on a road bike. I've been riding here now. My wife and I live downtown. I've been riding here from downtown for just over a year now. And the reason why I chose this topic is because before this, I was not a cyclist. I am a new cyclist as of 2 years now, and I wanted to share what biking has done for me first before we get into this topic. As it's common for us to have injuries, I myself have a disc injury in my lower back on the left side and a pretty bad injury to my right knee. And since biking, it has actually helped my knee injury quite a bit, but it did aggravate and flare up my old disc injury. And so I'm going to share with you sort of the strategies that I use to kind of help mitigate the symptoms that I had in my back into my foot, as well as and what the benefits it did for my right knee, and I'll cover that as part of the slide today. And I wanted to share that with you all. Today we'll be talking about the common complaints associated with cycling, whether it be road, mountain biking, or station bike, or a recumbent bike. We will also cover the major role your diaphragm plays in this sport, and specifically how the diaphragm can help improve your riding efficiency, which thus then leads to less injuries over time. Especially if you're a triathlete or you're doing longer pieces, jumps in the mountain bike, or long distance road cycling. So we'll be talking about some great strategies here today, but aside from all of these different implementations, rehab, positions, and exercises that we will cover, none of those really matter as much if the bike does not fit your body. Anatomy is important. We are all unique in our own ways. We're all built differently. Therefore, if you are riding for long periods, specific anything over 20 to 30 minutes, which requires you to be in a sustained position over a length amount of time, it's especially important to get your bike fitted to your needs. I am not a bike specialist, but I do recommend seeing either a tech or someone who you know who is quite good at fitting these bikes, and get the bike fitted for you, because then when you implement these strategies, you can really notice the difference, as was my experience since getting my bike fitted to me quite recently. So we'll start first from the top and move down approach. Common complaints associated with cycling, specifically in the neck, outside of just neck pain, so we'll dive a little bit more into detail. For example, some in the clinic here, I see a lot of individuals who suffer with either a stiff neck or a sore neck, typically during their rides or at the end of their rides. Some may also complain of nerve-related pain in the arms. Now, when I say arms, the nerve type pain or sensation can start from the shoulder, move into the elbow potentially, or have some numbness, tingling, or potentially even some weakness or a sort of a throbbing, aching sensation into the hands as you're riding, whether it be mountain bike or road cycling, depending on the position of the bar that you have. Some also complain of a pinching sensation, almost like a stabbing sensation in between the shoulder blades while you're riding or during your ride. And finally, headaches post-ride. Headaches are not a common complaint with riding, but depending on these other sort of key points that we talked about earlier, specifically with the stiff neck and the nerve-related pain, they can lead to or contribute to developing a headache either during or post your ride. And the common areas where these headaches present can be in the frontal region, which is just around this area. It may mimic or feel like you're wearing a tight headband around the head. They can also be in the suboccipital region, which is in the back portion of your neck, right at the base of your skull. And it can also present right along the temples. At times, it can be on both sides of the temples. It could also be on one side and refer potentially above the eye. Now, I'll start first by covering how can you modify your riding position specifically to help alleviate or reduce any of these symptoms that you or someone you know may have. I'll start first with neck position. I'm going to hop on the bike for this because I think it helps for us to visualize how and what type of positions can alter and affect those conditions. So, for example, if you are in a road bike or a mountain bike, the bars tend to be pretty high up, like in this region here. And as I'm riding, depending on my neck position, right? So right away, if you can see, my neck is drooped down, but my chin is tucked forward. And so what this position does, it creates a shortening of the suboccipital muscles right through here, especially on long rides. This position is more commonly seen if you are a down bar rider. Not so much if you're in a tri-bar, because the shoulder and elbow position actually helps to create some stability and support for the neck for long pieces, anything 30, 45-minute rides. And so the neck position can really affect the distribution of the stiff or sore neck complaints, or particularly the headaches. So if you have any of these, dive into the neck position. Am I like this? And if I am, maybe what I can do is just allow the shoulders to drop a little bit, which is the next bullet point right there, shoulder position, and allow a gentle chin tuck, almost thinking like there's a straight line from the back of my head all the way to the base of my neck. So that position, and if you're on your bike and you kind of play around with this motion here, you'll find, okay, when I get to the very end there, I do feel some tension here. When I get all the way to the bottom, I also feel tension here, and it's not safe because I can't see where I'm riding. It's very common. So you find that middle ground, and that may require you to be looking up towards the eyelids a little bit, or you potentially sit a little bit more upright, which allows you to focus a little bit more through there. And that is as simple as just raising the handlebars on your bike. Next, shoulder position specifically. If your shoulders are up next to your ears, right? If your shoulders are right by your ears, that will contribute to a lot of the sort of frontal or temporal headaches, specifically because this muscle right here that attaches from the base of your neck down to the edge of your shoulder and shoulder blade region is called the upper trapezius. The upper trapezius, when stays shortened over a length of time, no different than if you were working primarily in a desk for long periods, and over time you kind of creep into this position because the body is just unable to sustain this upright posture for long periods. There needs to be modifications. And what that will do is that can create potentially a tension headache into the temple region or into the back as well. The amount of tension that one holds or carries in their chest or neck can also play a big role. And that's kind of where the diaphragm plays a big role here. Specifically with hill climbs, or if you're gearing up and doing a resistance ride, there will be some amount of tension and stiffness in the body to be able to sustain the resistance in your stride. But when you're out of that climb or the resistance ride, most climbs, I hope, is no more than 10 minutes at a time. Otherwise, you're really working hard, and I commend you for that. But typically, when you're out of those climbs, it's a good way or a good moment for you to kind of check in. Okay, regulate my breathing. I'm at my resting pace. Where's my chest? Where are my shoulders and my neck, right? The tension is kind of all encompassing sort of into these different positions. So be mindful of that next time you're on the bike, and if you start to notice these, something as simple as just allowing the shoulders and the chest to just kind of hang off your torso as you're firm on the handlebar can alleviate a lot of these symptoms. And finally, jaw tension. I am a jaw clencher by nature. I do it in my sleep, And I definitely do it when I climb on my way here to work. And the one thing that I didn't realize was I forgot to tell myself, stop clenching your jaw. You're done with the climb. You're going downhill. Relax. What the jaw tension can contribute to is the headaches along this region here as the temples. As we clench down hard on our masseter muscles, it can create overactivation or a mild spasm, which can then refer into a headache pattern, either on the sides, and it can also be up into the front. So if you or you know somebody who has any of these symptoms and you try these positions and they work, great. But if these do not work, something else may be at play here. And that'll be a perfect time for you to seek out your healthcare practitioner, either it be a chiropractor, physio, massage therapist, anyone in the movement fitness industry who has, they essentially know how to sort of manage these types of complaints as part of their practice. We'll move next to the slide here. Next, I want to talk about lower back pain and cycling specifically. I'll start with my story first. I have a history of a disc injury on the left side of my low back. And initially when I started riding, the first few months of riding out to here, since we moved our location from uptown to here, I've added about 25 minutes to my normal commute. And what that did was it essentially created sensations of tingling and even numbness into my left foot about 15-20 minutes into my ride. It wasn't an issue before because it was more of a volume issue. I got to a certain volume or distance ridden, and then I hit my threshold, and then boom, there goes my symptoms. And so, and I did also have stiff and sore lower back post my rides. I did not, thankfully, have a lot of pain during my rides, but I would occasionally get the catch or the twinge when I come up from a bent over position, because riding is somewhat of a bent over position, but there are parameters there which you can modify or alter to alleviate some of these symptoms. Some can also complain of constant buttock tightness, and the buttock tightness or the glute tightness can be one-sided, and this typically presents after the ride. Say you went for a ride, and after the ride you're like, oh, my glute is tight, and you stretch and stretch and stretch, and then the next day, yep, there it is again. Right? And so the strategy is to stretch and stretch again. But if that didn't work the first time, there may be something else at play here, and that requires an assessment or an evaluation at the least. Some also complain of IT band pain, which is a common one that is on the outside of your knee, potentially. Now, for me, when I had IT band pain, I didn't have true IT band pain. It was, in fact, pain that was referring from my disc injury into the knee during my rides because of my position on the seat. And again, and lastly, the last symptom here that's common with lower back pain and cycling is leg pain or numbness, tingling into the ankle or to the foot. These sound serious, especially in the presence of pain. And if you do have any of these and none of these positions work, at the very least, I recommend getting an evaluation so that you at least know what the diagnosis is and how you can manage moving forward, right? Is a road bike good for you? Is a cycling bike good for you? Maybe you want to consider switching to a recumbent bike or a recumbent position temporarily to alleviate and reduce these symptoms before hopping back on the upright, more road bike, saddle bike. So how can you modify your body and your position to alleviate or reduce any of these symptoms? I'm going to hop on the bike again and we're going to go over these. So the first one is sitting position alters lower back position. So when you're sitting on the saddle, again, I'll go back to my initial point about the importance of getting your bike fitted properly to you, because the seat not only moves up and down, but it also moves forward and backward. So depending on the position of your seat, it will influence the position of your pelvis. Ideally, in a perfect world, you want to have a pelvis that's leveled from here to here. But because on a road bike, as an example, you're in this position. So for example, I'm in this position right now. I feel pretty good in this position, but as I start to ride and exert, I tend to go into a little bit of a wink where we create a little bit of forward bending in the lower back, and that is a provocative position for my disc. And so what do? I try to initiate and maintain diaphragmatic breathing, which helps to create more stability through my rib cage and pelvis. And that the movement of the diaphragm as it descends when I take a deep breath in and control the exhale almost creates a little bit of a distraction effect, which then helps alleviate a lot of the pressure potentially to my disc or the nerve that created or resulted in the numbness into my foot. The other thing I wanted to talk about, and I mentioned this briefly, is the position of the rib cage. So say we alter the position of our pelvis, pelvic rocking, a good place to practice this motion and find your position of neutrality where there is little to no tension at all in your hips or your lower back is to do it in a quadruped position. So if you go into sort of a crawling pattern, hands and knees, it's a very good place to kind of rock your hips back and forth to be able to find that neutral ground. And that's sort of like the sweet spot. It's different in everybody. Some people are built more into this pattern, some people are built into this pattern. So it varies depending on the person. And finally, I mentioned this in the beginning, but I'll talk about seat position. Depending on the position of your seat, either forward or backward, so say if my seat was forward, and every stride I take, it's heavy on my quad. I'm getting very little hamstring activation, which can then potentially create stress and strain through the knee, specifically in the front of the knee or into the kneecap. I'll cover the knee later, but these are just some common things that you'll see or experience. And if you modify these positions, specifically the big one here is the diaphragm activation, I find that helps me a lot. So going back to my story, my experience, 25 minutes into my ride, my left foot starts to go numb. And then I think, okay, how am I doing? Right? My bike is fitted to me, so I know that if I alter my position of my rib cage, right? So rib cage flared, not a good position. Rib cage rounded, also not a good position. So I find that neutral ground right about there, and I feel quite comfortable there. And this position actually is where my rib cage is parallel to my pelvis, which allows proper activation and descent of my diaphragm down into the space, which creates sort of a distraction effect. And after about 10, 15 breaths or so, as I'm continuing to ride, I just lower the pace a little bit. My foot numbness starts to creep back up, and then it starts to go here, and then eventually I continue to, it's work. I will say this, diaphragmatic breathing during your cycle is not easy. It requires effort, but so is riding. We shouldn't be lazy when we're riding. We should be active. It's a pretty active activity, yes? Holding yourself in this position, specifically for the neck pain and the shoulders. Yeah, you can rest in this position, but you don't want to be completely locked out as well, because that is inefficient riding. It requires more effort for you to hold this position over time versus being a little bit loose through the elbows, soft in the grip, and allowing your diaphragm to help hold most of your body weight in an upright position. This is mainly for when you are in your working pace of your cycle. If you're hill climbing or if you're sprinting, you're going to be in the down bars or you're going to be up on the saddle. In those positions, you just do it. Yes, you can't really alter them because that's a sprint, right? And we all move very differently. So depending on that, for me to be able to dive into those specifics, I'll need to see you move. I'll need to do an assessment in order for me to determine, okay, if none of these work, what else can work? Yes? And again, if none of these positions help to alleviate these symptoms, a good place to start is getting an assessment or an evaluation by a practitioner so that you can determine why these things are happening, why they continue to happen during my ride or post my ride, and then we can tease out these provocative factors, basically getting you on the bike, seeing how you ride, getting you to squat and lunge, watching the position of your knee to your foot and the hip and the relationship of these limbs, right? And also the position of your upper back and your neck. So I found a lot of relief through these positions, specifically the diaphragmatic breathing. That's helped me a lot, and it continues to help me today. Finally, another common one is knee pain specifically and cycling. I touched on patellofemoral pain syndrome earlier, specifically if the seat is really, really far forward and you're striding, you are using mostly quadriceps and very, very little hamstrings, which can then create a repetitive strain through the tendons in your quad tendon and your patellar tendon or your infrapatellar tendon. We call it patellofemoral pain syndrome because it's typically due to a repetitive type of motion and very unlikely a cause for trauma. Meniscus injuries, most commonly traumatic either from a contact sport or if you stop and twist, that can also create irritation to the meniscus. It's very unlikely you'll sustain a meniscus injury or an ACL injury while you're riding unless you fall off the bike and you're staying clipped in and your knee hits the ground, and that can create that mechanism. I have an ACL and a meniscus injury in my right knee, and since riding, especially after getting my bike fitted and implementing these strategies that I've talked about earlier, it's really helped my knee pain. I typically get about 3 or 4 flare-ups per year, like clockwork. I know, oh, okay, right around this time, especially when the weather's cold, I know something's gonna happen here. And since I've riding, I've been able to not have any symptoms whatsoever into my knee. And so if you or you know someone who's dealing with a meniscus injury and they're like, well, my knee hurts, I don't want to go hiking, I don't want to run. Biking is actually a pretty safe exercise for meniscus injuries, especially once you're out of the irritative phase. You can work through a recumbent bike or an upright station bike and still be able to work your cardiovascular health, your legs, without irritating the meniscus injury. Biking's good. IT band pain is also another common complaint, and now a true IT band pain unrelated to pain referring from the lower back typically presents on the outside of the knee, and it's due to overactivation of your TFL muscle due to a number of factors. Most commonly, if your glutes are tight all the time, it's going to stay in a shortened position. Glutes are external rotators of the hip, meaning this motion in particular, especially if you're on your feet. And so if your glutes are tight, you're going to be pulled outward slightly. So if I look at you from here, say my left hip is tight, my left hip will stay in sort of this resting position. And this is my stride technique here, right? Straight on the right, but a little fanned out to the left. So what does that do? That creates overactivation of my TFL muscle, potentially, which can then cause increased tension and strain through the IT band and present as pain in the knee. Other common but not so frequently mentioned, hip or ankle pain is typically associated with riding. Now the hip pain specifically and the IT band pain tend to go hand in hand because at first it's the TFL or tensor fasciae lata muscle, which is a continuation of the fascia of your IT band as it inserts down into the outer part of your knee. As we overwork this space, when a muscle gets overworked, it's going to fatigue. And when it fatigues, something else will take over. Hip flexor. So then your hip flexor starts to do most of the work, not your quad, not your hamstring or your calf and diaphragm. And then you have a hip flexor strain, which is also pretty common in cycling injuries. So what do? We can modify first to see if it alleviates these symptoms. I'll start first with stride technique. If you're wearing clips for your bikes, the push-pull can be quite comfortable and pretty easy to notice the difference dialing in. But if you're in a bike where you're kind of clipped in like this, it's not as easy to be able to initiate the pulling motion with your hamstring, and it's more easy to push because you're not clipped in. So if you do ride frequently, I suggest getting shoes and clips fitted to your bike because that will really help to change or alter the way you initiate your stride technique. So if somebody's dealing with patellofemoral pain syndrome or you have pain up in this knee, maybe what you can do is alternate. Maybe be more mindful of the push and pull in your stride. Because initially when I started riding, before I wore clips, I was just pushing. Push, 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 push. And then a couple weeks later, I was like, oh man, my knee is really bugging me. And then I decided, you know what, I'm gonna alter it. Maybe I'll just do a push, push, oh, pull, I remember to pull, okay. Push, 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 pull, I remember to pull. And since then, it's really changed how I feel, particularly the areas of tension or stress and strain through my legs. The next thing you can change once you're fitted with shoes that have clips is the clip angle. A lot of times the clips on the bottom of your shoes can be adjusted. They can go left and right, up and down, and they can tilt. Depending on the anatomy or the position of your hip, knee, and foot, you can alter those positions. For example, when I first got my clips, I had my clips all the way to the outside, meaning all the way to, so this is my right shoe. I had my clip all the way to the outside of my shoe. And what that did was, because now I'm pushing on the outside of my foot during the downward stride, it created we call it a dynamic collapse, where my knee would cave in every time I push down. Knee goes in, because I'm only pushing on the outside of my foot, not through the center or the base of my first and second toe. And so what I did was I just changed the angle over and I turned it out a little bit to fan outwards, and that completely eliminated the position of my knee and hip, as well as reduced and alleviated a lot of the tension that I felt in my medial meniscus. How do you know what angle to alter? An assessment would be necessary. And it's as simple as we look at somebody's squat, right? So for me, when I squat, I have to assume an turned outward foot position because of how my hip is built. Now, if you're one that can squat dead on like this, all the way with your bum down to the floor, this may not matter as much. So it really depends on the body type and the position that you assume. So stride technique, clip angle, those are the first two good places to start in terms of how can we alleviate these symptoms in our ride. The other thing to do is get an assessment of your hip, ankle, and foot, specifically in the squat or lunge pattern, which I mentioned earlier. And this is because a lot of times when we have knee pain at all, outside of getting trauma to the knee, it's very uncommon for the issue to happen directly as a cause from the knee. We typically, in our practice at least, we always look up the knee and down the knee. For example, for me, my knee was fine. It was the position of my foot and ankle during my stride that altered my knee, which then altered my hip position. So instead of addressing the pain at the knee or treating the knee at first, I changed the position or relationship of how I use my foot and ankle and stabilize in that position, and that corrected everything else upstream. And that could be the same in the hip. You look at the hip and the relationship of the hip joint, and you can move downward to alleviate these symptoms. And again, I mentioned this earlier, but I put it on here. Knee pain recycling is often a result of the hip or the ankle issue and not a standalone issue related to the knee. All right, now we'll talk about the role of the diaphragm and how the diaphragm can really play a big role with cycling, specifically if you're dealing with a pre-existing injury that just kind of limits you from riding that much further or not at all. The diaphragm, as we all know, is to help us breathe, but it does more than breathe. The diaphragm does postural stabilization, specifically with how we assume our position on the bike, the posture that we hold on the bike, as well as with exercises, working at your desk or on the computer, and finally, sphincter tone. Sphincter tone specific to the pelvic floor muscles in your body, your bladder, and everything else around the area. So, the position of your head on the bike, head, chest, and pelvis are critical to be able to dial in proper descent of your diaphragm into the pelvic floor cavity to then create a reflex stimulation of those muscles. So correct activation actually allows you to have a balanced muscle activity around your trunk, therefore translating into the hip, knee, and ankle. I like to use this analogy. Think of your diaphragm or this area here as a tree trunk. If you've got a tree trunk that's weak and flailing, the branches are going to fail. But if you've got a tree trunk that's stable and rigid, but fluid in motion, your arms and your legs will be able to effectively generate force in an efficient way, rather than having to overexert to sustain or create the force or position. So it might be a little bit difficult to see where you guys are sitting, but typically in a pathological position of the diaphragm. So for right here, this is the bottom of the pelvis, or right about here actually, but this is essentially the bottom of your pelvic floor, and this is the top of the diaphragm. On the bike, which I'll demonstrate here. So for me, when I ride and my leg symptoms come on, I'm typically in this position, which is overflexion of my thoracic and lumbar spine, which then creates pressure through my disc injury, then putting pressure on the nerve, which then creates numbness into my left foot. So what do? I alter my position, and then now I'm able to center my rib cage over my pelvis. My head is in a comfortable position. I'm not here or here, right? I'm just nice and upright. If you have a time trial bike, the handlebars tend to be quite low. So when you're here and you can't alter this position, you can create a little bit of modification for the head position, right? And my ribs. Instead of down, which is that pathologic position here, we call this an open scissor. When I'm down like this, I can create stress and strain through the mid-back or even into the lower back specifically. And so modifying those positions, trying to get the sort of most comfortable position to exert force in efficiently will take some trial and error, yes? And best to do it when you're on a bike, either on a station bike or on your road bike. Go on the Goose, go on a trail where there's no cars, so you know that you can just practice this, clip in, clip out, and take a break. And so here, you'll see an even position of the top of your diaphragm relative to the rest of your lumbar spine and the bottom of the diaphragm. And again, in our last presentation, we talked about the role of how to efficiently breathe in your exercises. Most tend to breathe out into this position, and that is because of this open scissor position, because we're creating compression in the muscles in the back, which then allows expansion this way. And so if you alter the position of the rib cage, you can then allow more of a 360-degree breathing mechanism. Think of your trunk like a piston. Pistons move up and down, and they're very, very, very powerful, right? If you take a little nick or a crack to a wall of the piston or the wall surrounding the piston, you're going to blow a gasket immediately, right? And it's no different than the analogy here. So diaphragm, 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 in terms of how to improve your riding efficiency and generating power. Because if you implement these strategies, you ultimately prevent the need or the risk of developing an injury because your body is moving as it should with respect to your specific anatomy. Yes? Now, how to improve riding efficiency and injury prevention. We talked a lot about the different strategies on how to modify your riding position, and specifically how to use your diaphragm. So a good place to start is just to alter your breath pattern. So 4, 5, 5, 5. 4, 5 means 4 seconds on the inhale, 5 seconds on the exhale. You can also implement this breath pattern for your distance runners, yes? It will be a bit challenging at first, especially if this is a breathing pattern that you have not practiced, and you may feel a sensation of breathlessness, like you, crap, I need to take another breath in. But I find if you just kind of hang on there and fight through the mild discomfort, typically about 30 seconds to a minute later, your body will start to regulate. And that's because of the relationship of having the sensation of breathlessness and what that does to the blood chemistry in your body. You actually offload more oxygen into the tissues with less breath because it increases the acidity of your blood chemistry. We don't need to dive into that. This is not a chemistry class, but there is science behind this. Nasal breathing versus mouth breathing. When I started riding and I started to implement this, I tried nasal breathing in, mouth breathing out. Nasal breathing in, mouth breathing out. And then eventually I was able to move through nasal breathing only and no mouth. Coming, during the springtime and the allergy season, when I show up here, I just have snot all over my face. But you know what? That's okay. It makes for a really comfortable ride. And now since I'm now at a 5x5 breathing pattern with nasal, and it takes me about 45 minutes to get here. And before doing this, I'd be gassed before I start my shift for work. And yes, some of it is due to muscular adaptation to the distance traveled over time. But I think a big component of why now I'm able to ride back and forth and feel quite good is since developing this sort of nasal breathing pattern. It's not easy, but I find a lot of benefit from implementing this strategy. I'll touch again on the proper utilization of your diaphragm. If your diaphragm is strong and stable, you have a strong stride. Stronger stride, but generating more power with less effort, which then leads to improved cycling efficiency. And finally, prime the system and prep work on your off days away from the saddle. So what can you do once you've got an assessment or an evaluation, and you can then determine, okay, I have this and this when I ride, so I'm going to practice X, Y, Z. Do the work. The days that you're not riding, get on the ground, do some breathing exercises, do your dead bugs, your side planks, your bears, any of those positions to help to get some muscle memory into the position of your rib cage over your pelvis. And then over time, when you get comfortable with it on the floor, you translate that gradually to the saddle, and you'll start to see some pretty cool gains into your ride, especially at the end of your ride. Some closing notes. Please, if you want to dive a deep dive into this and alleviate a lot of these symptoms that you may have with riding, get your bike fitted. You're all built uniquely and differently, and your bike should match your body type. If you're dealing with an injury, please seek help. An accurate diagnosis is one of the keys to be able to alleviate and reduce injuries and prevent it from happening again, especially when you get back onto the bike. And finally, be safe out there, guys, and enjoy the ride. Thank you for coming today.